When I was 3 years old, I almost died. As you can see, that didn't happen. That's a good thing, right? My mother called the pediatrician in a panic. The doctor said, get Peter on the phone. He listened. He just listened to me breathe. And I couldn't breathe. And he said, get Peter to the hospital immediately. My mother rushed out of the New York City apartment, hailed a taxi, because that's what we do in New York City. We hail a cab, and rushed me to Columbia Presbyterian Medical Center, where they immediately put me into an oxygen tent. Well, the first rule of back in the 60s, when that's what they did, put you into an oxygen tent, the first rule of an oxygen tent is to turn it on. And they did not turn it on, so I was turning blue. And blue is not a good thing, you know, blue face is not a good thing, unless you're a member of the Blue Men group, right? Right. So the doctor comes in, turns it on, and he saves my life. Now, throughout my childhood, asthma plagued me. In fact, in 5th grade, I missed 40 days of school. But every time I went to the doctor, he listened. He took care of me. I felt like he really cared about me, and it made me feel better. He gave me a normal childhood. I was able to run, play baseball, and be a normal kid. But when I was 9 years old, I found my why, my purpose. I wanted to help other people feel the same way that doctor made me feel. And we all in this room have a purpose, the reason that got you here. Now, that purpose got you through biochemistry, physiology, neurology, your boards, your exams, and through your residency. And it's what got you here. So, I will tell you that you need to know your purpose, because life will have challenges. And what I'm going to share with you today will challenge you, but it is your purpose that's going to hold you steady. So I want you to write down, not right now, your purpose in life, and read it every morning and every night, because you're going, like I said, have these challenges, and that purpose is going to get you through them. So the system is rigged. Did you ever look at a patient's chart and see that a service that you wanted to provide was not covered, so you did not offer that service? Well, you might have offered the service, but you didn't offer it with the gusto that you should have offered it. The excitement, like, well, we got a laser, we got shockwave, we got this, we got all these other alternatives, you know. And you know what? That's not how you're supposed to do it. So did you ever do that? And we all have at one time. So I remember in my 4th year of practice, I hired my first associate. And I remember this one day, he looks at a patient's chart and he says, oh my God, this patient's insurance does not cover orthotics. I guess this patient's not going to get orthotics today. So I walked up to him and I said, you are right. This patient is not getting orthotics today. He looked at me sort of confused, and I said to him, the moment you put that thought in your head, it became true. You made a decision for that patient without even walking into the treatment room. And that's exactly what the insurance company wants you to do. They don't want you to offer these services. They, increasing premiums, they increase deductibles and copays, they decrease your reimbursements, and they do not allow services that should be offered, and they don't cover these essential services. It is the greatest scam in financial medical history. And when every time you let the insurance company dictate how you practice, they win, they become wealthier, and you lose. And Napoleon Hill said, whatever the mind can conceive and believe, it can achieve. And that works both ways, right? So it works if you actually believe something, okay, in a positive way, and also in a negative way. Now, the way you handle this, by knowing this phrase and keep it in your head. It is your obligation to treat the patient, not the insurance company, okay? So it's your obligation. Your sole purpose when you see a patient is to get them better quickly and immediately and basically completely, all right? So that is your total mission. Every time you choose not to offer a service that is not covered, like I said, the insurance company wins and you lose. And the patient on top of that loses. So let's talk about selling. We think it's a bad word. We hate to use the word selling. Sales, it's a bad word. Selling just means service. It's all it means. Providing service to a customer. In exchange, when you provide something, you get value and you get money. Okay, so money is just an exchange of something that you provide. And you need to understand that because you're providing value to that patient. What is a dirty word is silence. What gives you the right to look at a patient and decide if they're going to pay for something or not? Correct? These patients will pay to get better. They will pay to get out of pain. They will pay to run again, to be able to walk without grimacing, to be able to actually play with their grandchildren. They will pay, right? Now, you have all the tools in your toolbox, and if you don't, they're all out there right now. Michael brought them all here for you. And even if you have these tools, we're not using them consistently because we are dictating if the patient's going to pay us or not. And like I said, you don't have the right to do that. The tools help you stay modern. Patients don't want needles. They want painful procedures. People are getting treatment today from the internet, from Instagram. They're buying things left and right to get rid of their pain, to look beautiful, to if you're on Instagram, I'm looking at Instagram, I just had a video almost going 2 million views. Yeah, and I wasn't in it, that's why. There was a Grey's Anatomy clip that made a point. But people are on Instagram all the time and just quickly want a quick fix. You have the solution. You have the answers. You are the experts. You should be telling them and go online and say, this is a bunch of BS. Let me tell you how we can fix it without painful needles and injections and surgery. That's what people want. And you have to give them what they need in order to get what they want. Your silence isn't protecting them, it's costing them. It's costing the patient. So let me tell you a story about Betty and Veronica. You know Betty and Veronica? No jughead in this story, okay? And this is relatively true, except for the patient's names. Now, imagine Betty comes to my office, and has heel pain. And I said, okay, we can take care of that. I eventually give the patient, Betty, a pair of custom orthotics. She feels great. She's walking out of my office feeling fantastic. She is walking and sees her friend Veronica, and Veronica is limping. He says, why are you limping, Veronica? And Veronica said, I have heel pain. Oh, I got the guy for you. His name is Dr. Wishnie. Go see him. He's fantastic. Veronica comes to my office, and I do the same exact thing I did to Betty. But there's a difference here. Veronica's insurance does not cover orthotics. So I said, Veronica, unfortunately, your insurance doesn't cover orthotics, but you still need this. She said, I only want what insurance pays for. And she doesn't get it because I didn't do a really good job of telling her why she needs them and what's going to happen when she doesn't get them, okay? So Veronica walks out of my office, and a few days later, she sees Betty. And Betty says to Veronica, you're still limping. I thought you went to see Dr. Wishnie. Now, is Veronica going to tell Betty the truth, that I can't afford a pair of orthotics? That's embarrassing. She will say, Dr. Wishnie couldn't help me. Now, Betty won't refer another patient to me because I couldn't help a friend. So you're hurting your business, you're hurting the patient, you're hurting everything but the insurance company. They win. When you go into the treatment room and sell, these questions you need to have on your mind. When you see a new patient coming in pain, what does that pain prevent you from doing? This should be in your chart. And remember that information every time they come back. What does it prevent you from doing? I can't run because of the pain. How important is it for you to run again? Well, it's really important. What would happen if you can't ever run again? I'll get depressed. I just won't be myself. This is something I need to do. Well, Mr. Jones, you're in the right place because I can help you. I treat a lot of runners with this problem, and I can get you running again in the next few weeks. And he said, that's great. So let's get started. How's that, Mr. Jones? Let's get started. And that is really, really, really important. I also explain if you're right now in a position that 95% of the time, I can get you better conservatively, without surgery, without painful needles, whatever. But if you wait 6 months or longer, your fasciitis can become what I call fasciosis. And I don't use big terms. But in other words, there won't be any blood flow back into that heel. And you're going to have a really thick scar tissue around that heel, which now you're more likely to undergo surgical intervention. I let them know that. What would happen if it's left untreated? So you have to give people what they need in order to give them what they want, right? That's so important. So the real enemy here is fear. You have these tools, you have all these toys, right? We don't necessarily always use them. We understand that we have to have our purpose inside a treatment room because our purpose is to take care of the patient, right? But why aren't people consistently using these toys? And that is because of fear. Fear, the 6 kinds of fear, okay? The first one is fear of rejection. No one likes to be told no. Now, if a beautiful Victoria's Secret model walks in right now, for all of you, okay, men and women, and you're single and available, and you ask this model out, you want to ask this model out for a date, right? But you're afraid she might say no. And if I ask that model out, she'll probably say no. But there's a small chance, like, that show, remember that movie, Dumb and Dumber? Oh, I still have a chance, right? There's that small little chance that maybe in a few hours, we'll be like Netflixing and chilling. Okay. If you haven't, you know what Netflix and chill means. Okay. And so we don't want to take it personally, right? Don't take it personally. Fear of sounding like a salesperson, not a doctor. That's where your purpose comes in, right? I'm going to talk about that in a second here. But, you're not a salesperson. The difference between a salesperson and a doctor is a doctor believes in their service and the results and really cares about the person. A really good salesperson is that kind of person that really cares about the customer, the client, the patient, and you can see it, you can feel it, okay? Fear of being seen as unethical. It's unethical to sell something for $1 gazillion, right? And that's not necessarily true because we spend a lot of money seeing athletes and entertainers perform. And why do we do that? Because they make us feel good. We buy emotion, right? And so we complain that these athletes are making a lot of money, but we still pay them. We still go out and watch them play. And you do something just like that. You make people feel good. You get rid of their pain. You give them a better quality of life. You're worth every single bit of it. You fought through medical school for what purpose? To get people to feel better. There are not many athletes and entertainers who can do what they do. There are not many foot surgeons who can do what we do, right? This is our art. This is our craft. It's not that easy. We basically fought through medical school to do this. So now we're here to help them in any way possible. Fear of damaging the doctor-patient relationship because you brought up money. Projecting your own financial anxiety on the patient. Your financial issues, you can't pay maybe your staff, so now you're projecting it onto the patient. They can't afford it either. And the one thing that a lot of people won't talk about, your self-worth. The voice says to yourself, who am I to ask all that to get paid that kind of money for this procedure, this pair of orthotics? Who am I to ask for that? And you need to understand your value. And this is how you overcome that. When it comes from your heart, it never sounds like a sales pitch. You truly care about them. And a lot of us, when you hear the word no, you immediately think it's no, and you just say, okay, it's no. And there's always a saying no, and when you're giving your presentation, make sure that the patient understands why they need that treatment before you tell them the cost of something, the investment in something, because that's what they're doing. They're investing in their health. It has to come from your heart. So I would like to let you know that 3-year-old boy who couldn't breathe actually became a doctor, who listened to their patients, got them better for decades, and fulfilled his purpose in that aspect. And I need you to understand this. You didn't fight through medical school to let an insurance company's spreadsheet dictate how you treat a patient. So remember to treat the patient, not the insurance company, to give the patients what they need in order to get what they want, and come from your heart, because it never sounds like a sales pitch. If you do that right now, and to this very day, this moment, we have a day and a half of this, 2 days of this. Start having the practice you so deserve and the life you so deserve, and it starts right now.